Good afternoon.
Good afternoon.
This is an auspicious occasion because telehealth is the future of healthcare, and right now the future is bright. It's bright for patients who have easier access to care. It's bright for healthcare providers who can better meet the needs of their patients. It's bright for public health because it boosts our efforts at prevention. And it's bright for the American taxpayer because it cuts costs and saves money. The challenge with telehealth is that our laws are outdated. They were written long before the first iPhone was envisioned. And because of that, we have many restrictions in place for Medicare about originating sites, geographic limitations, about the types of providers that can provide telehealth services, and so on. And over the past few years, we've changed federal law together to bring it more in line with the current reality and the current opportunities that technology make possible. We've passed provisions that expand the use of telehealth in accountable care organizations and Medicare Advantage, as well as for home dialysis patients and the evaluation of acute strokes. These are real steps forward, and they wouldn't have been possible without the people and advocacy organizations here today. But we really need to do more, and that's why we are excited to introduce a new, updated version of the Connect for Health Act. This will build on our progress and expand on the use of telehealth. It will give the Secretary of Health and Human Services the flexibility to waive any restriction, such as where patients must be located in order to use telehealth. It will also make it easier for Medicare beneficiaries to use telehealth, especially for mental health and emergency medical services. For Hawaii, this legislation will fundamentally improve the way our families get their care. On Hawaii Island, on the Big Island, there's a shortage of mental health professionals. Psychiatrists from Honolulu have to routinely fly in to close the gap. And when it comes to accessing mental health treatment, waiting for months for your next appointment or for your doctor to fly in from another island has real consequences. Our bill will allow a person who lives in Laupahoehoe to video chat with their psychiatrist using an iPhone or an iPad to get the help they need, when they need it, where they are. Common sense measures like this can and will save lives in Hawaii and across the country. I want to thank my colleagues, Senator Wicker, Senator Cardin, Senator Thune, Senator Warner, and Senator Hyde-Smith, as well as those in the House Congressional Telehealth Caucus for their commitment to this work. And I also want to thank their staff. It's an extraordinary enterprise to put together a bill that can get consensus from many groups and that have historically had a difficult time coming together. So the momentum is here, the technology is advancing, the business case is stronger than ever, and on health care, we have bipartisan consensus. Together, we can push this effort forward and ensure more people get better care. To do that, we need to focus on, one, expanding coverage, and two, containing costs. Now, Democrats like this bill primarily, but not exclusively, because it improves access, and Republicans like this bill primarily, but not exclusively, because it saves money. Everyone loves this bill for all of the right reasons. And now I'd like to turn it over to Chairman and Senator Roger Wicker.
Well, I want to improve access, and I'm sure Brian wants to save money, too. Well, this is a red letter day, and as you can see, we are bipartisan up here. We're bicameral, and we have a much improved product from our already great product of previous years. Dare I take the time? Why don't we just mention some of the endorsing organizations? I'll leave some out, and that'll be bad. But thank you to AARP, Alliance for Connected Care, American College of Emergency Physicians, AMA, American Nurses Association, American Psychiatric Association, American Psychological Association, and they're different, American Telemedicine Association, Connected Health Initiative, Healthcare Information, Management Systems Society, Federation of American Hospitals, National Association of Community Health Centers, National Association of Rural Health Clinics, and the University of Mississippi Medical Center for Telehealth. So thank you, and those of you who are here, and I didn't call the name of your organization, I don't mean anything by it. I want to congratulate our House colleagues for coming up with a nifty idea of a working group that put this out for comments. A lot of times we pass a law and we put it out for comments and regulations afterwards. We got 100 comments submitted through the process to our bright House members, and I think we have a better bill because of it. As my brother Brian Schatz alluded, this is the future of health care, and we need it almost everywhere. Now, Ben's from a big state with urban centers, but out there in the panhandle of Maryland, they need it, and on the Eastern Shore, and we sure need it, don't we, Senator Hyde-Smith in Mississippi? We use it already, and we have to. We're a rural state, small towns, rural communities, and we struggle with provider shortages and chronic health issues. We're already tackling this, and I've mentioned the University of Mississippi Medical Center. I may mention them a time or two more, you never know. But we're healing people and caring for people every day with telehealth. Thanks to their efforts, specialists in the capital city of Jackson, which is our biggest town, are consulting instantaneously with people in the rural hills and in the rural delta. We've caught the attention of the FCC. Commissioner Brendan Carr visited with me in the Mississippi Delta and saw how good this idea is, and I think appreciates what it can become. He then came back and testified at a Commerce Committee hearing after our visit and described how real-time treatment from remote doctors is a winner. The evidence is clear. Telehealth can work, is working, will continue to expand and continue to improve the lives of Americans. So I'm glad to be part of this, and now I'm happy to turn over the podium to my friend Ben Cardin.
Well, first, let me thank Senator Schatz and Senator Wicker for organizing this opportunity for us to come together in regards to the Connect bill and using technology. I really do want to thank all the groups that are here. So for Senator Wicker's benefit, you're right. You can come out to the western part of our state, as I have in Oakland, Maryland, and telehealth technology is critically important in order to get access to care. Or you can go to Pocomoke City, which is the lower Eastern Shore, pretty remote location, where telehealth has been a godsend in getting health care needs. But I must tell you, you can go any place in the state of Maryland, and technology is making a huge difference, the use of telehealth. Because a lot of people just can't go back and forth to doctors. They don't have that luxury to be able to do that. And if you want to get timely help, to try to schedule appointments and coordinate those appointments where you could do this through telehealth means that you'll get access to care a lot quicker, the quality will be much better, and the cost will be less. So this is going to help people throughout the state of Maryland. I also want to underscore the point that Senator Wicker said. We were proud that we passed legislation that was enacted in 2018 and made a difference. But we then asked for the stakeholders to give us ways that we could improve it. And you all responded, and this bill reflects what the stakeholders say they need in order to remove obstacles for the expansion of telehealth services. As Senator Schatz said, we have geographical limitations, we have service limitations, that we have reimbursement limitations. So we are looking for ways that we can make it easier for us to expand technology to provide better access, to provide quality access, and to reduce costs. Better healthcare outcomes, less expensive, and much more convenient for the people of this country. That's our objective, and that's what we've been able to do with this coalition to support this bill that will expand these issues. I'm proud to be on this team. I am hopeful that we'll be able to show that this is certainly a bill that can bring all of us together and make sense for our healthcare system, and one that we should be able, hopefully, to move through the Congress of the United States. We have 100% of the Mississippi Senate delegation that is with us on this bill, so I'm pleased to turn the podium over to Senator Hyde-Smith.
Thank you so much, Senator Cardin. And you do have 100% of Mississippi support because it is very, very important to us, as it is every member standing here looking at you today. But, you know, one of my top priorities has always been to improve access to rural health. And this is going to do so much for our citizens. Yes, it saves money, but more importantly, it saves lives. The University of Mississippi Medical Center, we had Secretary Wilbur Ross down there that I had the opportunity to visit with on telehealth medicine. We need to capitalize on that and continue to grow because we know how important it is. But I want to thank each and every organization that responded, that had a part of this, of everyone behind me that was determined to get this done. This is critical, this is important, and it is a very good day today in Washington, D.C., that we can come to this podium, both Republicans and Democrats, and get this before you. Thank you so much for your participation. I, for one, am very grateful.
Thank you very much, Peter Welch from Vermont. And to keep the good news rolling, you have 100% of the Vermont House delegation. And where the House delegation goes, Bernie and Patrick are sure to follow, okay? Mike Thompson can't be here, and he's been a leader in the House and, of course, is dealing with wildfires for the second year in a row in his district. But he's been a champion. I just want to acknowledge that. It's important for the reasons that you've heard from the prior speakers. And, by the way, my wife and I took our vacation in the Mississippi Delta. And wonderful, wonderful place with wonderful people, but it's rural. And it's a long way from here to there if you want to get health care. That's true in Vermont. And one of the aspects of this bill that I find so wonderful is that all of us represent rural communities. And all of us know that the pressures facing rural America are really intense. Using technology to help folks get health care in their community, that is incredibly important. It's important because then you can have a community. You've got to be able to have access to a lot of things like education and health care in your community. And when we've got this pressure on our rural communities that is so intense, and we can use a tool of technology to let folks who want to live there and continue to make those communities vibrant. This is tremendous. And anybody who's had the opportunity to look at the quality of the video on telehealth, you are present. It is vivid. So whether it's a personal interaction for mental health, or it's a wound that has to be treated, or there has to be a specialist who's helping to give a diagnosis to a local community hospital, it really, really works. The other thing is that we've got pressure on our rural hospitals. They want to treat people, and the people in those communities want to be treated where they are. And this is a tool that will allow the hospital to provide services that they can, but without having this incredible burden of having to try to compete for specialists. We're in rural parts of our country, in rural Vermont. We really can't do it with the urban areas. It just can't be done. But we can team up and get the benefit of their expertise at a reasonable cost in the place where folks are. So this really does make sense. Whether it's focused on getting access or getting costs down, we have to bring the cost of health care down, but not at the expense of access. So what's a creative way to take advantage of the technology and opportunities we have in this bill does it. So it's a real pleasure for me to be, along with Mike Thompson, a strong supporter. Now, you finish hearing from the politicians, and I can introduce somebody who knows what she's talking about. And that's Dr. Karen Rubin, Director of the Center for Telehealth at the University of Virginia. Thank you. Thank you.
Wow. Good afternoon, everyone. Senator Schatz, Senator Wicker, Senator Cardin, Senator Hyde-Smith, and Congressman Welch. We are so thrilled to hear and to learn about the introduction and participate in the introduction of this comprehensive Medicare reform package for telehealth, the Connect for Health Act of 2019. I also want to thank my senators, Senator Warner, who's a co-sponsor, and also Senator Kane, who's been a wonderful supporter of telehealth as well. As a physician, and I'm a pediatric cardiologist, as director of the University of Virginia Center for Telehealth, as a past president of the American Telemedicine Association, and now as a Medicare-eligible individual as well, living in not a rural area, Charlottesville, I know firsthand the profound benefits of improved access to high-quality care for our patients supported by telemedicine. Our telemedicine program serves many thousands of patients in the Commonwealth of Virginia annually, across the life and the care continuum. Like others, Mississippi in particular, Vermont as well, Hawaii, we offer life-saving acute care services in emergencies, consults, and follow-up visits across more than 60 different specialties and subspecialties of healthcare, remote monitoring for chronic illness, and desperately needed mental health and substance use disorder services. We have saved Virginians more than 20 million miles of driving for access to health care through our telemedicine program. Telemedicine bridges the miles between patients and their care. By reducing geographic and originating site restrictions in Medicare, the CONNECT Act of 2019 will greatly improve access to care. It will mitigate workforce shortages. We know, just as we've heard, rural communities and some suburban communities do not have specialty services even in those communities. And it will most importantly improve outcomes at lower costs for our expanding nation's vulnerable populations. Coupled with our national priority of expanding broadband access, these efforts will enable all Americans to enjoy better health and health-related prosperity. I'm also profoundly grateful to the broad range of stakeholders who join us in applauding these efforts of Senator Schatz and his fellow members of Congress who came together, bicameral, bipartisan, to introduce this critically important legislation today. We thank you from the bottom of our hearts. It's my privilege now to also introduce a dear friend and colleague, Ann Mon Johnson, who is the CEO of the American Telemedicine Association, and I know she is equally thrilled and delighted for this legislation. Ann.
Thank you all. And as the only national organization entirely focused on advancing telehealth, the ATA is honored to be here today to commend our congressional champions, all of you, on the introduction of the Connect for Health Act of 2019. The ATA represents a broad and inclusive member network of providers, including UVA, as well as the University of Mississippi, Children's National here in D.C. in the audience, as well as payers, health insurance plans, and solutions, and organizations, alliances that are of the many who responded with comments in terms of how to improve the legislation. So thank you for taking our comments into consideration. Our members are extremely proud to have worked with leaders in Congress and are very excited about the most comprehensive telehealth Medicare reform package from this Congress. The ATA as an organization is committed to ensuring that everyone has access to safe, affordable, and effective care when and where they need it. We believe that the ability to obtain care remotely is key and critical to achieving this vision, and the introduction of today's legislation is an important step to achieving this shared goal. I could go on about all the different elements of the bill that have already been pointed out, so the nice thing about being last is that you don't have to repeat it. I just want to say that we are extremely excited, thrilled to be here, to be part of this group, to promote this legislation, and thank each and every one of the congressional champions of telehealth and their help. Thank you.
We'd be happy to entertain any questions. If not, thank you very much.